Hello and namaste to everyone. I want to thank all the people involved in organizing Global Indian Scientists and Technocrats meeting held as part of the 6th India International Science Festival IISF 2020. I'm really honored to get an invitation to present my works and be a panel member. And in this video capsule, which I prepared based on my work on the artificial intelligence model and the mobile app technology for identification of COVID-19. During the month of January 2020, when coronavirus started, usually most of the my previous work involved mathematical modeling of epidemics. But this particular work, I thought that using mobile phones and artificial intelligence model, we can identify coronavirus much quicker and because of the large scale of infections we already saw in January, February 2020. At the time, I designed this model using the mobile phone apps and then with a background of artificial intelligence modeling framework. And then once I developed the model, I asked my clinical colleague, and then we together come up with, I asked my clinical colleague whether he would like to look at the clinical part of the work, and then he agreed, and then we jointly published the article once the model is done. And then this is the first mathematical model with a mobile-based app and AI, artificial intelligence framework, which published in the month of February 2020. And then immediately, when we published this work, this attracted worldwide attention, which I will show later. And before I go to those things, and then let me explain you how this model works. In the first phase, we collect the basic travel history along with the more common signs and symptoms using a mobile phone-based online survey or through an app. And then in the second phase, thousands of data points, whatever the data collected through this app at the front end, will be analyzed through the model, that is the AI artificial intelligence framework. And this framework would tell the individuals who have responded to the mobile phone based survey whether they have any risk of having a COVID-19 or not. If they have a risk of having coronavirus, then they would be advised to go to the nearest hospital where the testing will be done. If they don't have, then they will instantly get a message that they don't have to worry. These are based on the signs and symptoms and the travel history. So it works in the two-phase model. And this is the first such model. When I proposed this idea, this was the first such model which can use the mobile phone-based technology and the background AI model. And then you all remember, during the initial days of coronavirus, there were lockdowns and people could not go outside. So this kind of technologies were proposed really to help the community and society in a quicker way. And then the pictorial, if you see that, suppose this is a geographical region, then these are the houses, and the circles are the households which are living in a house. So these are the various hypothetical households. And then once we have the data information, when we ask them to respond to the survey, the individuals, once they respond, and these are the responses, and the blue color indicates the individuals don't have the same signs and symptoms or travel history related to the coronavirus, and the yellow indicates they have not responded, and all the blue indicates they all have the response, or they all responded. And some of the respondents, based on their response, they would have some of the red color, these are all among the blue. That means they are all have some signs and symptoms. And then when they respond with that symptoms, immediately, they either a mobile-based van can come for testing, or they can give a lift to the particular individual, take it to the nearest center. And similarly, we had also planned that time to giving a barcode for the individual or some identification for the individual, so that when the individual reaches the hospital or the testing center, the hospital testing center also will match that individual's identification, so that these two are matched, and the same individual being, whoever the person responds to the survey, the same individual will be tested instead of the misuse of the identification. Someone testing the someone responding to the online survey and someone else being tested, that would not be possible. So that will be that will be taken care. And then the once the individual respond, but then here the individual response is very important. They have to respond to the survey. That's the most important. And this is some of the yellow color in the circle. That means they have not responded. So non-responding individuals, the mobile phone app, mobile-based app cannot be used unless someone else fills for them that under the situation. But somebody will respond, never want to respond, then this kind of apps cannot be done. So this is the basic idea of the app. This is the first mobile-based app, and with the background of AI model that came in the. So myself, Arni Rao, and my clinical collaborator, Joe Vasquez. So as I mentioned, once I developed the model, everything, then Dr. Vasquez, he helped to look at the structure there, because I use the CDC, WHO publicly available information based on the criteria that time of the year, 2020 February, and that time of the year, whatever the CDC, WHO, and they have all this information, I try to use that information, only public available data and information on the criteria for the mobile coronavirus symptoms. And then one of the theorem technical, I won't go in technical details. One of the central theorem available in this paper is, suppose there are some individuals are in a region, and that particular theorem would give that what is the probability that so many cases are identified among the so many responded. So what is that probability that, given that, so many individuals are identified who are in the, what is the probability to identify certain individuals when some other individuals are responded to survey? That what, if N1 in cases are identified and when small n are individuals who are responded to survey, then the probability that, N1 will be identified is N1 multiplied by N by N square. And I'm not going into the details of that, this anti-proof and various other, all the algorithms, how to trace everything there in that article, which is the HE, Infection Control and Hospital Epidemiology, which is the Society for Hospital Epidemiology of America's flagship journal, which I mentioned in the beginning slide here. So this is HE, Infection Control and Hospital Epidemiology, which was submitted in February 2020, and then got accepted 25th February, and then immediately available in the first week of March. And then this work attracted worldwide attention. For example, almost 150 media outlets all over the world, various languages, they all highlighted this work, and it received wide attention. I'm just selecting a few of them here just to show that, there's the mobile health intelligence media. They say that AI-powered smartphone app offers coronavirus risk assessment. And then several scientists in India, and they wrote in their articles, and then I want to thank them also, some of them, when I gave several webinars in India. So they say that Arogya Setu, which the government of India fantastically launched, and Indian response was so pragmatic. So they say that the Arogya Setu app, and that was inspired by my work, whatever I published in the month of February, and which received wide attention. So I want to thank all of them, and giving an opportunity. I'm really honored that my work was useful practically. And then the Fast company, which also mentioned, was one of the leading company to write out the business of the business technocrat businesses. And then they said that, do you have coronavirus? Scientists are working on an app for that. And then the Campus Technology, they said that the coronavirus app to provide at-home risk assessment. And then the Jaguar wrote the app, AI worked together to provide rapid at-home assessment of the coronavirus risk. And then the Innovators Technology app detects coronavirus risk. And the Economic Times in India, they wrote that, worried, sick, or coronavirus, an app could soon come to your rescue. So these all came in the first week of March. These are just few out of 150 or more in various regional languages in the world. They are published. Thank you for your attention. And feel free to write an email or contact me through email or any other way. I'll be happy to respond to you. Thank you. And this work gave me an opportunity to consult various airlines industries and various other hospitals. I'm really honored to to work closely with the various practically useful technologies and health administrators and government officials. I thank them all for wonderful support and their dedication. Thank you.